Just an overview. I'm also quickly talk about small assessment, digital assessment techniques, so that we can, which can help us in decision making, how to progress with ACL rehab. So ACL injury is just a quick overview, common in sports, causing instability and pain. Our challenges normally with therapist is swelling, muscle atrophy, risk of injury or re-injury. Some of the innovative solutions would be comprehensive rehabilitation plan coming up with weight unloading and aquatherapy, which can help to fasten the progress. So we all know ACL helps us to prevent tibial translation as well as rotational instability. Most of the injury mechanisms can be indirect, where pivoting and cutting can lead to ACL injury. Contact injuries can also affect ACLs. Healing phases, inflammation, proliferation, remodeling. I'll quickly go through these. This is just a small video about the mechanism. I think from morning you must have gone through it. Volume है क्या इसमें? Audio आएगा? ठीक है, but I think we can skip this. So traditional ACL rehabilitation, early phase, we all know rise, isometric, partial weight bearing. Mid phase would be strengthening and your neuromuscular control or the proprioceptive training, and the next phase would be plyometrics and your sport specific training. Limitations in this sometimes may be delayed mobility, fear of a re-injury. As I told you, I'm going to slightly talk about some assessment techniques, digital assessment techniques. Why they help is they help us to have a baseline measurement. They help us to identify the specific deficits in the patient's muscle imbalance, customize a rehab plan for them, track recovery progress, prevent re-injury, and also return to sport decision making. Some of the assessment tools, what we use is, we have a force plate where we can do balance assessment, where we can know where is the balance going when a patient is standing, if the right is injured, whether his weight is shifting to the left more, and then gradually we load them on the right. There would be force assessment where we know what is the difference between the left and the right. Stability of stand, what's happening when they are standing, are they weight bearing on the right side which is affected or no? Active weight transfer, are they able to transfer weight forward, behind, left, right, what's happening, and we can track that progress when we are treating them. Pedometer would be more how fast they are doing, so reaction time training, and weight distribution. Again, this can be tracked over a period of their rehab so that we know that they are improving. And sometimes if we are going behind, so we know when we have to go slow in their rehab. Also, we do something like a gait assessment where we can identify specific muscle imbalance as well as joint range of motion, which can be assessed, tracked, and then treated. This is a small video of the gait assessment, what we do. There are two sensors which go on the foot, and it helps us to track. So you just have to walk 10 meters. And it helps us to track the vertical displacement of hip, knee, and ankle. So it shows the red one is the left side, right one is the green one is the right side. If you see, the left side weight bearing is less. So it tracks velocity, cadence, as well as your stride length. On those 4 columns, it tracks your heel strike, your knee bending, your ankle movement, as well as lateral deviations. So vertical lift is your knee bending, lateral deviation, foot position, as well as heel strike. So these can be kind of our baseline assessments for treatment. Now coming to my main topic, weight unloading. Why weight unloading? That's important. So it reduces mechanical stress on the healing tissue, prevents your muscle atrophy while promoting neuromuscular control, because we can go early in water, allows early mobilization, reduce adhesions, and reduces stiffness. So water is not the only way to unload weight. There can be anti-gravity treadmill which can be used, pool-based unloading in water, which helps, we take use of buoyancy, your hydrostatic pressure and your viscosity for training, as well as body weight support harness system can be used, as well as there are something called as end effector robotics, what we use in our center, can be used for weight unloading training techniques. Coming to end effector robotics, this is the way we train. So there is passive mode and assistive mode. It has a force plate which tracks your weight bearing, so the patient knows actually what's happening. The patient can actually communicate with the screen. There is different difficulty level. There is something called as slope which comes, so you have to put more effort. A mud which will come, so there is something called as virtual training. So different environments, mud, slope, treadmill, as well as staircase or so in staircase, you will have to bend your knee more. On treadmill, you will have to walk fast. On mud, you will have to put your pressure more on the leg. And on your slope, you will have to slow down. Other harness training techniques would be body weight support. This is a harness, on-ground harness. There is also a body weight support harness. So this gives more confidence to the patient that they are not going to fall and they can put more load on the legs accordingly. Aquatherapy, again, buoyancy reduces effective body weight, minimizing the joint stress. Viscosity can offer resistance, and hydrostatic pressure, which can offer compression, which helps to drain swelling and helps in reducing pain. Phases of aquatherapy protocol: first phase, pain management and gentle ROM. Phase 2 would be strengthening and proprioception. Phase 3 would be sports specific and plyometrics. Small range of motion exercises in water. So you can use these floats which will help you to kind of support the range. The float, when it goes in the water, is going to bring your leg to the surface. So it's going to help you to kind of move the leg with less pressure or no resistance. Then we can use fins to provide slight resistance when you're moving. Then you can use fins to walk in the water so that it will provide some resistance as well as some proprioceptive feedback. Strength training. Quickly, I'll go through this. Yeah, this video, where you can actually use the float to use the resistance of the float for strength training. This would be the next phase where you can do plyometrics. Yeah. So as we compare limited early weight bearing on land, risk of compensation patterns in water, immediate mobility, improved balance and muscle activation, superior outcomes with pain management and function. Anti-gravity treadmill, again air pressure support, so you can have that resistance. Quickly, instrument-based assessment can be used for coordination and training. Exoskeleton devices can be used for range of motion training as well as offering resistance. This is a force plate used for reaction time training as well as weight bearing, and this is a Pablo sensor used for end range training of the quadriceps. Okay. So in conclusion, weight unloading aquatherapy when combined with instrument-based assessments significantly enhances ACL rehabilitation. Instrument-based assessments training provides objective real-time data, allowing more precise tracking of progress. Together, these methods create a well-rounded rehabilitation approach, optimizing recovery, preventing re-injury, and facilitating a safer return to function. Thank you.